Hello and welcome to the final episode of our lung cancer awareness series, Voice for Lungs. Today we have with us Dr. Boman Dhabar. Thank you so much for being here. And today he is here with us to answer some questions for us. So I'll dive right into it. The first question we want to ask you is, why is there so much emphasis on early detection and screening of lung cancer?
As in any other cancers, detecting the cancer at an early stage has a lot of advantage. If you detect any cancer at an early stage, your treatment modalities required are much less. The cure rates are much high. Just to give an example, stage 1 CA lung, if you detect, your cure rates are 92%. At the same time, if you detect this disease in fourth stage, your morbidity, mortality, and the number of treatment options you have to undergo are phenomenal. So that is why we wish that all our patients, first, we should not get cancer. And if at all one gets cancer, it should be in stage 1. And my thoughts to screening, before screening also, smoking cessation, that's more important than screening. If you want to decrease the lung cancer burden, screening is of course very good, but more than screening, smoking cessation should be the first thing in our mind.
We also wanted to ask you that when somebody is going through or is planning to go through a screening process for lung cancer, are there any symptoms that one should look out for before going through the screening test?
Symptoms are generally if you are a patient, and screening programs are usually for normal people. So I don't think so there are any symptoms. It's a high risk if you are in a high risk, which I'll answer to you in my subsequent question, that what do you mean by high risk? If you are in high risk, yes, you should undergo a screening program for lung cancer. At the same time, what you should be aware that lung cancer screening is not just one-time affair. It's a long-term thing, and it's a combined modality and information that you should know, that it's a regular thing that you should undergo. It's not just one-time shot of CT scan and you go away. More than just one, it's more, you should be more committed to that than
as a process altogether. We also wanted to ask you, what is it that one must know about lung cancer screening? What is the process like? What is happening for an individual to undertake this process altogether, like you said?
First, lung cancer screening is for those people who are high risk. And by high risk, we define those people who are heavy smokers. What do you mean by heavy smokers? Those who smoke 20 packs per year are defined as early smokers, who are current smokers or who have stopped smoking within last 15 years are all in high risk, and age is between 50 to 80 years. These are all people who come in high risk, and these are the individuals who should volunteer themselves for a CT scan. That is what we call as a low dose CT scan chest. Generally, it is done once a year. There are many trials in this. Most of the trials say that the screening should be done once a year, and one should be aware that once you are doing the screening, what are the chances of some negative part of it also.
Right. So the people who you say are at high risk, these are the people who should be going in for an LDCT, what we call.
Screening.
Right. Thank you for that. What are the benefits of early detection of lung cancer?
As I told you, any cancer, when you detect this disease at an early stage, first your cure rates jump up to more than 90%, like I told you in first stage lung cancer. Secondly, if you are detected in an early stage, maybe one simple surgery and you are out of it. You may not require further chemotherapy, you may not require radiation, you may not require further treatment. Whereas if you are detected in, say, just an example, in stage 3, you may require, apart from surgery, you may require radiation, you may require chemotherapy, many other treatment modalities may be offered to you. So and so forth. So obviously, if you detect the disease at an early stage, you'll decrease the lung cancer burden.
Are there any risks or downside to lung cancer screening?
Yes, it's a good question. There are downsides to lung cancer screening. Apart from exposure, which is not really much, because these are low dose CT scans and they are just done once a year, so the exposure is very minimum. But apart from it, sometimes you may find some non-specific things which will bother the patient, like say emphysema, coronary calcifications. Something like that. You find it out on regular, which is not related to lung cancer. Obviously, the person who undergoes screening gets apprehensive, and the doctor has to again tell them that no, these are not things that you should be worried about. So those are the downs thing. And sometimes you may find some non-specific lung nodules which may require again a biopsy, which will be the little bit of a downside of it. But of course, the pros are far, far more than the downside.
It's always
That's
better
why,
to know than
absolutely,
realize later. Sir, also, are there any other modalities available for screening other than LDCT?
Previous to this, people used to do sputum cytology, plain X-ray chest, but they have not shown to decrease the mortality, as we see in low-dose CT scan lung cancer screening. By this screening, we decrease the mortality of lung cancer by 20%, lung cancer specific mortality, which many times some of our drugs cannot reduce that much mortality. So, lung cancer screening by low-dose CT scan is one of the things on priority now for at least this high-risk group. And overall mortality, it is believed it decreases by 6% overall, or overall specific mortality. And lung cancer specific mortality decreases by 20%, which is far higher than any newer drugs also which can decrease the mortality.
Right. So you named two other processes before this.
Yeah, this is sputum cytology and X-ray chest, plain X-ray chest. But they have not been able to decrease the mortality by doing screening with them. So they are out for regular screening procedures.
Right. And how is this screening different from other sorts of medication?
Screening is a procedure.
Right.
Medications are tablets.
Yeah.
So screening is different. So
screening
will be
has
just a
nothing to do
low-dose CT scan.
All right. So the detection is higher in detecting mortality.
It's earlier.
Are there any other risks that are associated with LDCT?
Risks are not really much. As I told you, many non-specific things that can be caught up on the CT scans. As I told you, sometimes emphysema, sometimes coronary calcification. So you see this on the screen. It is reported. The person who undergoes screening will be upset reading it. So he will ask the doctor, what is it? So a doctor has to specify him that those are non-specific things. Those are not related to your cancer at all. So don't get worried. Sometimes as I told you, sometimes you get a non-specific nodule you may see, which could be a past infection. So once you see these nodules, you may have to undergo a biopsy. So the procedure gets lengthened.
Right.
But still, as I told you, the benefits of screening, which I told you, decrease by 20% lung cancer specific mortality, which is so high that it's much better to undergo low-dose CT scan for a high-risk individual.
Right. How often should one get screened for lung cancer?
Most of the trials say every yearly for first 3 years. It's a yearly low-dose CT scan.
Yearly.
So that's why a person who undergoes this should be committed for that. It should not happen that the person does the one CT scan and does not come back for follow-up. So these are all things which have to be told to the person who undergoes this.
The trick is being consistent with finding out whether if something is wrong.
No.
Right.
If there is a nodule, whether it has increased or decreased, what is happening? We have to follow up with that.
Right. When someone is diagnosed with lung cancer, let's say after an LDCT, what is the way forward after that?
Yeah, it's a good question. Many times, first thing for us is a tissue. We require a biopsy. So it depends where you find that nodule. Is it a solitary nodule, multiple nodules, and depending on that, a person undergoes a biopsy. The biopsy can be many times CT guided, means from here it is pushed, or through a bronchoscopy, which is called as EBUS.
Okay.
And mostly by this only we can diagnose by a tissue diagnosis. So unless we have a tissue diagnosis, we can never say that that person has a lung cancer.
Doctor, what happens when someone is diagnosed with lung cancer? What is the eventual way forward?
Especially if a person is diagnosed on a low-dose CT scan. I'm sure you mean that. So if a person is diagnosed as a lung cancer following a biopsy, the way forward will be to investigate for where does our patient stand, which stage is he in. And if we have to diagnose after a biopsy, and if we have to stage the disease, we require a series of radiological investigations, like maybe a PET CT scan to see how far the disease has gone. If the disease is gone to say early, stage 2, stage 3 or earlier or more advanced, then we may require a MRI brain also. Then one has to plan whether the patient is suitable for surgery or other treatment modalities.
Just in summary, I would like to ask you, what is the key takeaway from lung cancer screening?
The key takeaway is that we have to reduce the burden of lung cancer for everybody, for all human beings. And how do we decrease the burden? One is by smoking cessation. That's the first thing before screening, as I said. Because we believe 85% of the lung cancers are related to some form of a smoke.
Yeah.
So you have to decrease that burden, and smoking cessation should be upfront. It should be brought, and maybe the education should start at school, or when your peers are there, or when you start smoking.
At a very ground level.
Very ground
to
level,
reduce
this
smoking.
education should be there. That's how it is. Then next, let's come to screening. Obviously, screening is very, very important. And as I told you, if you take part in the screening program, if you are a very high risk patient, and I defined high risk patient earlier, so such persons, if they undergo lung cancer screening, if at all, God forbid, one gets cancer, they get detected in the early stage, and the cure rate goes up to 90%.
Thank you so much, doctor. That was it with our questions. Thank you so much for your time today. We really appreciate it. He's at length told us in great detail about how lung cancer awareness can be spread and how screenings help. So we should start at an early stage by quitting smoking. That will be great for all of us. And if it comes to lung cancer screenings, then we must be regular with them, and consistency is the key to living a healthy life when it definitely comes to any sort of cancer, I think, for that matter. That's all for today. Thank you for sitting with us.